Angela Grassi is an internationally recognized, award-winning registered dietitian nutritionist and the founder of the PCOS Nutrition Center, where for over 20 years she's been providing evidence-based nutrition information and coaching to people with PCOS. PCOS, of course, stands for Polycystic Ovarian Syndrome. Angela is the author of several books on PCOS and provides nutrition education to registered dietitians and other healthcare professionals through her online PCOS training course. She's received numerous awards for her work and is an adjunct professor at Westchester University and conducts research on PCOS. Having PCOS herself, she has been dedicated to advocacy, education, and research of this syndrome. You can see why she is the one I wanted to talk to about polycystic ovarian syndrome. So please enjoy my conversation with Angela. Hi, Angela. Thank you for joining me today.
Hi, Karen. It's great to be here.
I've been wanting to meet you for a long time, ever since I saw you on Leslie Bitel's podcast. So having you on this podcast has given me an excuse to fangirl you a little bit and cyber stalk you and look at your books and things. And I've been so impressed with all of the resources that you have on PCOS. So I'm excited to talk about that with you today.
Great. That is my area of expertise, and I love talking about PCOS. So let's do it.
So this, as you can imagine, PCOS, for those of you listening, is polycystic ovarian syndrome. And this comes up in my practice a lot. I get discovery calls like this because I work a lot in blood sugar regulation. But I'll tell you, I often refer this out. And I've actually referred, Angela might not know this, I have given her name to some people because I know this is a very specialty area. And while I can help people, I figure there's people like Angela out there. I would rather go to Angela with this if it was me. But before we talk about this, I'd like to know a little bit more about your background. Like, how did you get into dietetics?
Sure. How I got into dietetics, I was at Michigan State University, and I was always a big kid. I was always in a bigger body, and no one could explain why, because I was always very active. And I figured, well, I couldn't get into, I didn't want to go pre-med. I was interested in medicine, and then I took chemistry, and I was like, no. And I applied to nursing school, but at the time I didn't have enough credits, and I didn't get into nursing school. I'm like, oh, what's the next best thing to graduate in, still within 4 years? And it was dietetics. But being, a kid that's dealt with my share of diets and weight stigma, I'm like, oh, I'll go into nutrition and find out how to be healthy and lose weight and all that. Yeah.
Yeah. So, okay. So are you still in Michigan?
No, I grew up in Michigan, went to Michigan State, did my graduate degree at Northern Illinois University. So definitely Midwest. Took a job. I was starting to see patients at NIU for eating in the health clinic. I was the nutritionist at the health center on campus. Started to see more eating disorders and moved out to Pennsylvania, the Philadelphia area, to work at the Renfrew Center, which is an eating disorder treatment facility. And then I met my husband a couple of years after I'd been here, and been here ever since.
So from dietetics, from a fairly practical standpoint, to eating disorders, to PCOS, how did you make that leap, and what made you decide to work in that area?
Yeah, so there is a huge very high prevalence of eating disorders in PCOS. So I was working as a dietitian at the Renfrew Center, and I saw my first patient with PCOS, and she also struggled with bulimia, and her endocrinologist told her to eat an Atkins-style diet, no carbs, right? And here was this young girl who couldn't stop binging sometimes a couple times a day and purging. And, just felt so much shame because she couldn't stay away from carbohydrates. And that was my first patient with PCOS. And then soon after that, relatively soon, I started to exhibit symptoms of PCOS.
Yourself?
Myself. I didn't have a lot of the classic signs and symptoms. Like, one of the main hallmark signs and symptoms of PCOS is you stop getting your period, or your period's all over the place. Mine was always clockwork. So never really suspected that. I asked doctors, just test me for it. And doctors didn't know how to do it. They weren't looking at the right labs. And I didn't know enough about it at the time to know that they were, not being thorough. And I just always
Mhm.
had this gut feeling that something wasn't right. Why did I have acne showing up on my chin? Why did I just gain all this weight out of the blue, even though I'm, very active and I don't eat, as a nutritionist, you know how many calories it takes to gain weight. And it's not,
The
2
math
plus
wasn't adding
2.
up.
The math was not adding up. So um, finally, I saw a specialist in Philadelphia who was on medical leave and came back, and she did the right blood work. We did an ultrasound, and sure enough, I have PCOS myself.
What did it So when you were having all those symptoms and now you have a diagnosis, I feel like everyone's different when they get a diagnosis. Was that affirming to you or was it alarming?
Very affirming, because there was an explanation for why, I gained all this weight. It wasn't, we tested my thyroid, we tested all this stuff. I had doctors telling me, watch your diet, cut the calories,
Just
exercise
lose some
more.
weight.
And it just wasn't right. And yeah, to know that there was an answer my whole life that I was experiencing. Yeah.
Mhm.
And I just remember driving home from that doctor appointment, leaving Philadelphia and driving on the Schuylkill Expressway and just being like, I want to specialize in PCOS. Like, so many dietitians don't know what it is. If I didn't even recognize it in myself, even though I had, gut feelings, but didn't know enough about it, I
Mhm.
really want to educate people about this,
Yeah.
and made the switch.
Yeah. So, on that note, can you describe what polycystic ovarian syndrome is? What is it and how does it present? Like how would people know that they have it?
Yeah, it starts to show up in adolescence, but it's really tricky to diagnose in adolescence.
Mhm.
The first signs of, first of all, PCOS is both a reproductive disorder and an endocrine disorder. So it's two fields intersecting.
Mhm.
We see on the reproductive side issues with fertility and ovulation. We see polycystic appearing ovaries, so all these follicles surrounding the ovaries. And then we see on the endocrine side, we see insulin resistance, metabolic syndrome, a lot of cardiovascular risk factors, and all that. We see inflammation and a whole host of other conditions associated with insulin resistance.
Right. And then like you were saying that they weren't doing a thorough workup, they weren't doing the right labs when you first got tested. So, I mean, what are like if you were to go in now and you know what to ask for, what do people ask for? What are the labs that are done to diagnose this? Or is it a combination of labs, scans, signs and symptoms? What's the
Yeah.
diagnosis criteria?
Yeah. So the diagnostic criteria for PCOS is an agreed upon criteria.
It is an
And
agreed upon criteria.
it's an agreed upon criteria. So you have to have at least two of the following three. You have to have, first of all, irregular or absent menstrual cycles.
Mhm.
So that's basically 8 or fewer periods in a year. The second is PCOS is a condition of androgen excess. So high amounts of testosterone.
Mhm.
So you'd be checking for blood tests that show high testosterone. So a total and free testosterone blood level. And then also clinical signs. So sometimes somebody doesn't have high testosterone on blood work, or they could be on birth control, which masks
With
the
masks, yeah.
the hormones. And so maybe they have clinical features of high androgens like acne and hair loss and hirsutism, which is excessive hair growth on the
Mhm.
central part of the body.
Yeah. And I missed it when you said high testosterone. Is there a difference between testing total testosterone and free testosterone on this?
They're two separate tests, so you can use either one.
Either one
Yep.
is
Yep,
elevated.
either one. And then the third criteria is if they have the presence of polycystic ovaries. So
On a
they would do
scan.
it. Yeah. So they could either do an ultrasound, and they're not cysts, even though the name is polycystic ovary syndrome, right? They're
Mhm.
little tiny immature follicles that contain the egg that,
Oh,
because of the hormone imbalance, never got fully released and just hang out on the ovaries.
Oh, so it's not a cyst. They just kind of developed a little bit, didn't fully developed, and then they
Right.
just hang
They're
out there looking like.
exactly, they're teeny tiny follicles.
Okay.
Yeah.
I didn't know that.
So they can do an ultrasound, and what's new, Karen, that just came out in the fall was that now they can also test anti-Müllerian hormone.
Anti-Müllerian
Mhm.
hormone.
AMH. This is a marker of how many follicles somebody has.
Okay, because this is new to me. Because this sounds like malaria to me.
Okay, no, Müllerian hormone.
Okay, that's interesting. So that's
AMH.
another
It's a
another.
blood test, and they can do that instead of the ultrasound because
Okay,
we know that patients with PCOS tend to have high levels of AMH.
okay. So that's an alternative to ultrasound.
Yeah.
All right, all right. And then okay, so that's how people are getting diagnosed. And is this showing up? When did you say it's showing up in adolescence, or is it when you're 20s? When does it usually
Yeah,
show
it
up?
usually starts in adolescence, like right when somebody's starting to menstruate. That's
Mhm.
when all the hormones are going crazy and it's like the perfect storm. All
Right.
these hormones are rising. I mean, adolescence is a state of insulin resistance, right? Of growth.
Uh-huh.
And that's when we see a lot of the symptoms of PCOS showing up.
Okay, because it's additive then. You have the insulin resistance from adolescence added, and
Yeah.
then it just gets exacerbated.
Yeah.
And then sticky note. Um, so so you said that there's that intersection between it being a reproductive issue and an endocrine issue, and you're talking about the insulin resistance. So can you explain a little more about how blood sugar and insulin factor into this?
Yes. So that's what we didn't discuss with the diagnostic criteria, right? There's
Yeah.
no checking for insulin resistance, even though we know that about 90% of patients with PCOS have either high insulin or insulin resistance.
90%.
About 90%. And when we compare patients with PCOS to patients without PCOS, like weight match controls,
Mhm.
across the line, patients with PCOS have higher insulin levels,
Okay.
but it's not part of the diagnostic criteria.
Okay.
But, it's still good to test for it because there's such a high prevalence of it. To
Mhm.
the gold standard, like it is for maybe type 2 diabetes, is to do the oral glucose tolerance test.
Mhm.
That's what the Androgen Excess and PCOS Society recommend, as well as
Okay.
the International Evidence-Based Guidelines for
Okay.
PCOS to
And
do,
do they call
oral
for the
glucose.
insulin being tested at the same time or just oral glucose?
I believe they do. I always recommend the fasting insulin with
Fasting
it.
insulin too.
Yeah, yeah.
Okay.
And they can also do the HOMA. They can calculate, the degree of insulin resistance. A1C alone isn't sufficient. You'll often see maybe normal A1C levels in someone with PCOS, but they can have very high insulin.
High insulin, right.
Yeah.
So, I mean, and so having said that, normal A1C and high insulin, I read on your blog. So for those of you listening, if you're like, I need to learn more about this, Angela has a really good blog on her website. So, and I've been reading it. You do talk about continuous glucose monitors, which is my, big thing. So do you use those with your clients, and how helpful are they and how are they limited?
Yes, I have used them with myself and I've used them with my patients. And I will say it really needs to be individualized. It's not for everybody. It shouldn't be standard recommendation. And the reason is, I think some people become so focused on the number that it increases their anxiety. And we know patients with PCOS also have anxiety issues. Like their anxiety is really common. I don't know if it's a hormonal thing or if it's related to the androgens. And we also see, as I mentioned, higher percentage of eating disorders. So sometimes people get really fixated. Oh my God, I ate, an apple and my glucose really spiked up. But, it's like, well, you didn't have any protein or anything there with it. But it could be helpful for some people to use it as an experiment, as an observation, just to get to know their bodies a little
Yeah.
bit better, to understand it, to see what happens when you have, eggs and toast for breakfast versus oatmeal. How does your blood sugar do? And
Yeah.
everybody's different. I will say what I really noticed for myself that surprised me was I kept getting low levels.
Really?
with the continuous glucose monitor. Yeah, I noticed that my blood sugar really dipped. It never went high. I never had high glucose,
Interesting.
but it would dip into low levels. Yeah,
Just
and sometimes
overnight?
no, during the day it could
During the
dip too. Definitely
Oh,
overnight, I would see a pattern, like between like around 3 in the morning, it would dip.
mhm. And
And
sometimes that's from laying on it, but
right.
during the day,
But
interesting.
during the day, it would dip too, and that was really interesting. So when you have high insulin levels,
It brings it
that can
down
push
quickly.
glucose into your cells really quickly, and your blood glucose that was really high, or
Mhm.
maybe not even that high, but it's just so efficient at pushing glucose into your cells that it just drops.
Right. Especially when you're doing any exercise, because I've seen that with people, they'll go
Exactly.
for a walk and then have
Exactly. I
hypoglycemia.
would definitely see it drop with exercise. So, it could be helpful for some people, definitely, especially if they have impaired glucose tolerance, if they're on the
Mhm.
verge of getting diabetes, it could be really helpful. Um, but I don't recommend it as a standard practice for
Yeah,
PCOS for that
yeah.
reason. Yeah.
And I definitely I like them because the utility for education and assessment, but, I've rarely met a person who should be using one without some supervision, you know, and
Definitely.
feedback, because you can spin I've worked with lots of dietitians on them using this, and and it's such a new people aren't used to reading the data,
Right.
and it's easy to misinterpret it or overinterpret it or,
Right.
have unrealistic expectations of your glucose monitor.
Right, like, if you didn't know that there's the pressure lows, right,
Yep.
like what you were describing,
Mhm.
if you're sleeping on it and, it can make the levels go even lower. Let's say somebody wakes up and they check their monitor and their glucose is low, "Oh my gosh, I have to go eat."
I
When
know.
that might not be the case at all. Yeah.
Yes. Yeah, or I just, I'm wearing one right now because
Uh-huh.
I've got a program going and we installed a sauna last year. That's
Ah,
something we've been saving for a
nice.
yes. So I did the thing this morning where I like taking one in the morning. I like my breakfast, take a sauna, take a cold shower, and I'm
Oh,
good. But the just having my breakfast, the sauna raises your blood sugar because the heat and it uses an enzyme,
interesting.
so a hot shower or a hot sauna, so if you looked at my blood sugar around breakfast time, it just shot up,
Wow.
but of
How
course
high does it raise your glucose?
it depends, and of course, I
Uh-huh.
ate right about the same time, and I think it went up to, like, a little like 190, which
Oh,
would be
wow.
high for me,
Yeah.
but it spikes up, so high, and then drops back
Wow.
down because my temperature normalized when I got in a cold shower afterwards.
That's fascinating. Yeah, that's what I mean. It's kinda cool to get to know your body in that sense. We have that
Mhm.
technology now.
Yeah, but you can't overdo it. I have to you alluded to this, but I think most people who go into the nutrition profession go in with a bit of a, shall we say, food or body image issue, and
Absolutely.
I would say that the dietetic profession is rife with that, and
Yep.
so I need to set limits on my use of continuous glucose monitors.
Right.
Otherwise, it can
Yeah,
it's
sometimes too
more than
much
you need.
information isn't good either, right?
Right, right.
Yeah.
Um, that was that question. Okay, this is what I want to ask you next. I remember, I guess, at least 20 years ago, when the standard treatment for PCOS was basically go on oral contraceptives and lose some weight,
Mhm.
calorie
And cut the
restriction,
carbs. Cut the carbs.
and cut the
Yeah.
carbs.
Mhm.
So how much has that changed since then?
Well, they're still recommending weight loss.
Mhm,
They are still recommending the oral contraceptives as a first-line treatment,
mhm.
but they're now also recommending lifestyle treatment as a primary treatment approach.
Okay.
And we don't have a lot of good studies on nutrition for PCOS. There has not been shown to be one nutrition approach that's better than another, even
Why?
though I know that we do not have funding. PCOS is highly underfunded. Like it wasn't even a line criteria for the NIH what do you call it? Their budget basically until 2022, 2022.
Really?
Yeah. So PCOS gets like 0.01% of funding. So we don't have researchers, don't have the
Wow.
money to do good studies.
And do you happen to, off the top of your head, have a percentage of women who have PCOS?
It's about 1 in 10 is the estimate.
Really?
Oh
That's
yeah, it's
a
a
lot.
female condition. It's more common than type 2 diabetes. more common than endometriosis, and
Wow.
it's much more underfunded than, any of those combined. Yeah,
That's
yeah.
startling.
So, we don't have good studies, but we don't have any we have some studies that have shown that you can, eat carbohydrates, especially high fiber ones, right? And still
Mhm.
see improvements in your glucose, your A1C, your insulin, your testosterone. But unfortunately, the media, there's so much fake news
Yeah.
out there, so many
And clickbait.
misconceptions that's being promoted as a marketing gimmick. Like
Mhm.
gluten is a huge one. That
Really?
gluten's, yeah, people with PCOS should not eat gluten.
I
Yeah.
haven't seen that.
Oh, it's everywhere. Yeah,
Okay.
yeah.
So that
You'll see
actually
it.
leads me to my next question because again, in your blog, you've reviewed like the 2023 international, what is it, recommendations for
Yeah,
PCOS, the
yeah.
standards, and you commented on, some of the things that changed that you were glad about, and some of the places where you thought they missed the mark.
Mhm,
And you particularly said you thought they missed the mark on like nutrition
mhm.
recommendations because they didn't really and it I read what I was reading in your blog is you didn't seem to say that there was like a standard blanket nutrition recommendation for people with PCOS. It's very individualized. But I mean, you have literally written a book, books on this. So I'm assuming you'd be able to answer the question when I say, so what would you have written if you were writing the 2024 nutrition standards?
I love that, Karen. And I did have a look at the recommendations before they were published. Like I was able to give feedback, which is really cool.
They asked you. Let's see.
Yeah, yeah, they did. And I do a lot of research actually with PCOS too. So I know some of the researchers.
Mhm.
And basically, I would say that eat a variety of foods, right? We know there's lots of different nutrients in different foods that can help support health, that can lower the risk of cardiovascular disease and improve glycemic control, right?
Mhm.
We know that antioxidants are great for PCOS. It can help to lower inflammation, which when you have high levels of insulin, you tend to be in a low grade inflammation state. And we
Mhm.
do see high levels of inflammatory markers in PCOS patients.
Okay.
So antioxidants are great.
And
And
so
then
I'm gonna pause you there. So when you say antioxidants, like what are you recommending?
yeah, so fruits and vegetables, lots of leafy greens. These are all great omega-3
Mhm.
fats. Even beans and legumes have
Mhm.
antioxidants. So we get down to it, it comes down to fiber, as I mentioned before, and gut microbiome, because we're finding so much is related to gut bacteria.
Yeah.
And what's fascinating is we do have some data that people with PCOS have less diverse gut bacteria,
Oh,
and it's correlated with testosterone levels.
really?
Yeah.
That's interesting.
Yeah. So supporting your gut health
Mhm.
is really important.
There's fiber again.
Fiber, anti-inflammatory, and just overall good nutrition.
Mhm. Yeah,
Omega-3 fats can play a big role in that.
yeah.
And
And you
then
mentioned in your blog low glycemic eating.
yeah, and that's fiber,
And
right? And
that's fiber.
fiber and protein is lower in glycemic index, so it's not going to spike up glucose to the degree that low fiber foods do.
Yeah.
Yeah.
Yeah. Yeah, I've been reading about that too, the microbiome. I mean, it seems like everything we read about the microbiome just reminds us how little we know about the microbiome.
Exactly.
But I think the one I read recently was talking about the effect of statins because sometimes people take statins and then their blood sugar goes up. They start developing diabetes
Yeah.
and the kind of really interesting studies they'd done was they saw that statins reduced like Clostridia species and that then caused a higher blood sugar and when they repopulated it reversed that trend or they gave some secondary bile acids which also reversed it. So it was kind of showing to me, it was demonstrating just how important a diverse microbiome was and that they could prevent that by feeding a high fiber diet.
Isn't that fascinating?
Mhm.
Yeah.
Yeah. Yeah, really, really
Yeah.
fascinating.
So hence the support of not recommending a, low carb diet or a Atkins style diet
Yeah.
or keto diet for PCOS.
Yeah. but more smarter choices, more strategic choices of
Yeah,
carbohydrates.
balance, right? And balance with protein and fat along with those fiber-rich foods.
Yeah. And then other lifestyle things, because I saw in your review they were talking about sleep apnea.
Mhm.
So tell me about sleep apnea in PCOS.
Yeah, sleep apnea, there's a very high prevalence, and they're finding it's not weight related necessarily. It's more related to the higher androgen levels that it affects
Oh,
receptors in the central nervous system.
that's interesting.
Yeah,
And then we
really
know
fascinating.
that sleep apnea will cause insulin resistance all by itself, making everything worse.
Exactly. So
And
I screen my patients, for their sleep and sleep problems in general, are in
mhm,
PCOS patients, but screening for the sleep apnea for sure.
okay.
And it just explains so much fatigue and if they have high blood pressure and
Yeah.
all that. It all comes down to sleep too, because if you're too tired, you're not going to want to exercise, you're not going to want to prepare, different food choices for yourself.
Right. And so exercise. So I know there's always that you need to exercise more and eat less. But I read more about, being strategic with exercise and how it improves insulin resistance. And this is and then the follow-up question I'll just ask now is, especially with women getting into the perimenopause and the impact of stress on insulin resistance, I always, I see people doing like the hardcore cardio every day and overdoing it. And I always worry, well, if they overdo it on exercise or cardio, they're just increasing their stress bucket, which isn't good for their hormone regulation. So, how do you approach exercise in a really strategic way with your clients?
Yeah, I mean, we're not sure exactly the impact of exercise on PCOS. There is, a lot of those theories that doing really high intensity workouts can increase cortisol and cause more stress, which could then increase more insulin.
Mhm,
But I have seen some studies with PCOS that high intensity workouts were beneficial.
mhm.
What I recommend is what you enjoy doing because then you're going to be more likely to be consistent with it. And
Right.
even if you can just get a 10-minute walk in, like on your lunch hour, if that's the only time you have to move your body, that's really beneficial over time. If you can do it every day,
Mhm.
that's an extra hour in your week of exercise and just
Yeah.
little things like that. You can spread it out. You can do 3 10-minute walks, like when you get home, if you have a
Yeah.
dog, just getting out. But otherwise, doing things that you enjoy because you're more likely to want to do them.
Yeah. And you'll be happy.
Yeah. Yeah. But you don't and we see benefits of those we call them slow workouts, right?
Mhm.
Doing yoga, for example, has been
Oh,
shown to
yeah.
reduce testosterone and reduce even insulin. So
Yeah. Yeah. Um, so I know we've been talking about like diet and lifestyle and all those things, but do your because I know PCOS, this is a lifelong thing. This is you don't cure PCOS
and it extends into menopause. It
into
doesn't just
menopause.
go away when you start menopause.
Are people able to manage it successfully just with diet and lifestyle? Are supplements always necessary? Are they sometimes necessary?
It really depends on the person. We
Mhm.
do tend to see that a lot of times patients with PCOS are deficient in some vitamins like vitamin D.
Vitamin D.
And vitamin D plays a big role in insulin resistance and inflammation. We also see if they're taking metformin, that affects B12 levels.
Right.
So it really depends on the person. Overall, across the board, diet, lifestyle are the primary treatment approaches.
Mhm.
If someone's very insulin resistant, they might need certain medications, and certain supplements have been found to help improve insulin sensitivity and help to regulate periods too and improve fertility. So, like
Like
vitamin
what?
D, for example, vitamin D, that's something that was left out of the international guidelines that I would have put in because vitamin D is so important for ovulation and fertility.
So what ranges are you looking at? Because I know there's lots of disagreements about what's the optimal range, but for PCOS, what's the optimal range you're going for vitamin
For
D?
vitamin D, like what do I recommend they take? Well, I always
Oh,
like
no,
to
what range are you shooting for? What
Oh, I like to
vitamin D
see a
level?
minimum of 35.
Okay. Yeah.
Minimum. Yeah. But most people, they're not taking enough vitamin D.
Mhm.
Yeah.
Okay.
Yeah.
And then what about, what the other supplements? I want to ask about berberine first because it's having a
Mhm.
moment.
Yeah.
So, and I know you write about berberine. So,
Yes.
is that something that you use to do insulin sensitivity?
Yeah, absolutely. So berberine's been around for, hundreds of centuries. It's always been used as a treatment, it's
Mhm.
an herbal treatment for diabetes back in the day, right? And we know it can improve insulin. It can also improve fatty liver and cholesterol. So if someone's got all three of those, I might want to go with berberine for them.
Mhm.
But there's other supplements too that can improve insulin, like inositol is great for some people, and it can help to improve ovulation and egg quality and restore menstrual regularity.
Mhm.
And inositol acts as a messenger, an insulin messenger, kind of
Right.
between those glucose receptors in the pancreas.
And
So, and that,
when would you use inositol as opposed to berberine?
and you can use them together. So it comes with experience. So, if someone's looking at fertility, I would recommend inositol,
Mhm.
especially if they're not getting their period, because you want to stop berberine when you get
Okay.
pregnant.
Okay.
Yeah. And if they're very insulin resistant, and maybe they are getting their periods, then maybe I would recommend berberine.
Right.
Yeah.
And then I know there's different kinds of inositol, and
Yep.
that I forget which one's which and why you'd use one versus the other. So could you explain a little
Yes.
bit of that?
So there's actually, I think, like 9 types of inositol, but the ones that have been studied the most are myo-inositol and
Those
dechiroinositol.
are the 2 I've heard of.
Yes, and myo-inositol gets converted into dechiro. But they're finding in PCOS there's an enzyme defect, and that's happening way too fast. That too much myo is getting converted to dechiro,
Oh,
and it's depleting levels of myo-inositol. And we know that myo-inositol is the one that's highly prevalent in like ovarian in the fluid there. So we
mhm.
know it's really important for fertility.
Okay.
And they both have been studied. We do know that there's a ratio in the body. For most of the tissues, it's 40-1, a 40-1 ratio of myo to dechiro.
Mhm.
And there are some supplement blends that have that ratio to mimic the levels you get in your body. And
Right.
that has been studied compared to either one by themselves. And it's been
Mhm.
found that the ratio to be a little bit better as far as like metabolic stuff.
And now I'm trying to remember when you were writing about the recommendations, the international recommendations from 2023, did they mention anything about inositol?
They did. Yeah.
Okay.
They said it has potential basically, but there's not enough evidence to
Right.
recommend it as a first line treatment or anything.
As a first line treatment. Do you agree with that?
No. I've seen great. Oh, I got to tell you my story with it.
Okay.
I've had okay, so this is why I got into like supplements and stuff, because when I was diagnosed with PCOS, my A1C, and I was working out pretty much every day, lifting weights, doing the step aerobics a couple times a week, walking, living by myself, so I didn't have all this food in the refrigerator like I do now with 2 teenage boys. And when I was diagnosed, my A1C was 5.6.
Mhm.
And I was prescribed metformin, and I was on metformin, I think for like, I don't know, 10 years. And it kept my A1C, the lowest it got it to was 5.4. And then I started doing more research, and I wrote
Mhm.
a book for dietitians and did a lot of research on inositol. And I'm like, this sounds amazing. Like, is this too good to be true? And I just had my blood work done, and I told my doctor I was going to try it. And she's like, let's do it. So I took inositol and had my A1C checked again, and it went from 5.4 to 5.1 in 3 months. Kept going. 3 months later, it went down to 4.9.
Wow. I need to use inositol more often.
Try it and see
That's
how it helps
amazing.
you. Isn't that? I mean,
And
that's for me.
then what else
That's just
changed?
me.
Were other things changed in addition to that lab?
I mean, I always had regular periods, so I couldn't do that. But and I don't not craving. So when you have high insulin,
Yeah.
it's an appetite stimulant. So you tend to crave carbohydrates. Like for me, it was always sweets, and taking inositol. I still take it, and my A1C is in the low fives. And I see a difference when I skip a dose that my cravings are higher.
Okay.
Yeah.
That's handy.
So I
'Cause, you
hope
know
that there's more research that comes out about it. And I have
Mhm.
patients like, if you read my blog, like there's one product that I sell at the PCOS Nutrition Center called Ovasitol. And if you read like all the comments of people's experiences taking it, and it's just like, yeah, it just has similar effects with it.
Is
So
that one that you formulated?
no, no, that's manufactured by Theralogics, a great
Okay,
fertility supplement company.
great. So, in addition to those, we're talking about, like, appetite and things, and now I wanna ask you about the gut peptide medications, the GLP-1 receptor
Yes.
agonists and the GIPs, the Ozempics, the
Yeah.
things. And I know, now that there's big money in them, now we're researching more of this stuff. How have those been used, and do those have a role with PCOS?
Yeah, I think they do mention them in the guidelines. I got to tell you, I've had some patients that have had great success with them,
Mhm,
and we're able to cut their, fatty liver down. And, for them, this is the first time they've ever lost weight.
mhm.
And their A1C has come down. I've had some patients that just couldn't tolerate them at all and had to go off of them. And then I've had some patients that really didn't lose any weight on it.
Mhm.
So I think we're just beginning to see the impact. But I don't know, like 20, 30 years, all we've had for PCOS is metformin.
Yeah,
So it's kind of exciting to have a new medication that could help patients
yeah.
more effectively.
It always surprises me. This surprised me at first too, because at first glance, it was something that stimulated insulin production. And
Right.
I thought, that doesn't seem like it. That seems counterintuitive to make
Right.
more insulin. When you have an insulin resistant person, you'd want to help the insulin resistance.
Right.
So it seems like I it's, but I understand. I was just talking to Sherry Stoka for an interview a while ago about this, that they're finding, more receptors for these throughout the body. It has more global effects, but it seems like being able to, what's the term? Stratify your metabolic situation, your glucotype, to find out what's going on. Always that's the N equals
Right.
one thing, is when you stratify your particular flavor of PCOS, then, you get a customized
Right.
approach, which is what you do with your clients.
Right. Right. So I mean, I think it's going to lead to maybe other new treatments for PCOS as we learn
Mhm.
more about these. There's only been like a handful, one hand full of studies that have looked at GLPs and PCOS. So
Yeah.
yeah.
And are there other alternative treatments that are available for people?
Um as far as like, I mean, there's supplements, I mean, there's fertility treatments if they're looking for that, but not really.
Yeah. Um, so you've written books on all this stuff. Like, I'm looking over here, I've got your books pulled up. You got a PCOS workbook. You have the PCOS Nutrition Center cookbook, which looks really good. So when people, like, if people want to find you and work with you, are you still working with people one on one?
I am. Yep. And
You're
I
still
have
open.
yep, I do one-on-one. I really enjoy it, getting to know patients, and I have, ongoing clients. So they can reach out to me at the PCOS Nutrition Center.
Okay.
It's PCOSnutrition.com.
Okay. And we'll put that in
And
the description so you've got the
yeah, and
link.
I have a lot of resources on the website, a lot of articles. I really find that education is so important because, PCOS is so confusing. So once you have that knowledge and education, then you can make the choices that are
Right.
best for you. You can take charge of it better instead of letting PCOS control you, right?
And you have a quiz, don't you?
I have a
Do we
supplement
have a
quiz.
link? We have a link for
Yeah, yeah,
that?
yeah. Yeah. So you can put in, some of your risk factors, your age, it walks you through, well, what's your degree of acne and stuff like that. And it can give you some recommended supplements, and then you can pick if, you want to try any of those. Yeah.
Cool. So we'll put that link in the description for everyone. Um, and you have a program, don't you? Like PCOS to pregnant?
Yeah, I put together a mini course. It just puts together like a lot of the information that I work with my fertility clients with,
Mhm.
and I put it together in a little mini course. So that's a resource. And then I have a course for dietitians. So if
So for people like
dietitians,
me who want to
yeah,
tool up,
yeah, for continuing education credits. Yeah, it goes through PCOS throughout the life cycle, all the way into menopause.
great. And this is like a self-paced course. We sign up,
Absolutely.
do it at our
Yep.
own pace, get our
Get handouts,
insulin
client
in.
handouts in there, a lot of supplements. I cover, I think, over 20 supplements in the course. So
Oh, that's
very
really handy.
research based. I'm very evidence based. So
Good.
yeah.
Well, that's great. That gives me a place to go now after this interview. I'll jot down some notes from our transcript, and then I'm going to look into that. So, thank you very much for being so generous with your knowledge and your time today.
Thank you. Thanks for giving me the platform, the opportunity to talk about PCOS. And I hope there's some information that we covered to help others.
Yeah, I think there is. So, thanks a lot, Angela.
Absolutely. Thanks, Karen.